Good evening, everyone, and welcome to last of the points. So today we'll be discussing the ear and scalp point. So, so it's our good fortune, honor, and pleasure to have our teacher and mentor, Dr. Pramod Kohli. We have all been taught acupuncture by him. So he'll be taking us through auricular therapy and scalp points with the help of IGCP and MedTalks. Over to you, sir. Sir is Professor Emeritus at Stephens Hospital, and he recently retired as Director Professor from our college. Over to you, sir, please. Thank you.
It was at some point it was also realized that in some diseases, certain specific areas again in different patients, the same area for the same disease, it develops some sort of flake, some sort of scaling, some sort of a nodule, and some sort of a tenderness. So obviously there has to be some relationship between the disease and the ear. And this was further investigated by Dr. Paul Nogier. He was a Frenchman, and he developed the concept of the inverted fetus. That means the entire body is represented in the ear, and the body is represented as an inverted fetus. Only difference being here the fetus is not in flexion as it is in uterus, but it is in extension. Now I would like you to really look at this and get a mental picture, because this is what is going to help you ultimately get the points. Otherwise, sometimes you will say, oh, how can this point be there? This organ is nowhere there. But if you imagine the fetus in extension, upside down, all over the ear, and please remember the fetus ka position. Front of the fetus is facing the helix, that is posteriorly, not the other way around. Okay? So this is what all organs are being represented in the entire ear. Looks very, very confusing, looks very, very intimidating, but we'll try to make it a little easy. So this theory has been further investigated more recently, and one of the first documentation dates to 1980s. And it was there documented that this theory is actually true for about 75% of musculoskeletal pain. That means for every backache, there is a specific point in the ear which becomes tender. So that becomes a backache point. For every knee ache, there is a specific point in the ear that becomes tender. That is the knee point. And it also corresponds to those areas of the inverted fetus. Okay. Now, this was further investigated. They created artificial, iatrogenic ulcers in rabbits by injecting submucosal phenolphthalein in rabbits. And they found that an ulcer developed there. And at the same time, at a particular point in the ear, the rabbit's ear, the electrical resistance decreased. I told you earlier, acupuncture points are areas of high electrical resistance, low electrical resistance. That means energy can easily enter from here. Low resistance, isn't it? And it was further observed that when the ulcer heals, the resistance goes back to normal, what it was before the ulcer was created. So that further leads credence to the theory that really the disease in the body is somewhere related to the part of the body represented in the ear. And more than 200 points have been identified in the ear. You have to remember all them. I'm sorry, but some of them at least over a period of time you will learn to remember. So this is how we locate. Question is, how do we locate these points? Anyone? From our previous lectures, small ear, thick fingers, wide fingers, you cannot palpate, you don't know which part is being tender when you put your finger there. We talked about acupunctoscopes. You forgotten? What are acupunctoscopes? What are acupunctoscopes? Acupunctoscopes are devices, pen-like devices. So when you run the pen, the tip of the pen, wherever the electrical resistance is low, it gives a beep or even a visual signal, battery operated. So that gives you, that helps you locate the acupuncture point. That is one way. Or you can run the back of your filiform needles, which are relatively thin. The back, the handle, that is not pointed, so it will not hurt. So when you run it gradually across the surface of the ear, you can elicit a tender point. Otherwise, we know the locations. But how do we locate? For that, you first of all need to understand the anatomy of the ear. किसको पता है कि ear में क्या क्या होता है? ये होता है. याद है सबको? What is the helix? What is the anti-helix? Okay. So this part of the ear is called the helix. Okay. This is called the helix. And this part is called the anti-helix. Helix starts with a crus. This is called the crus helix. This is called the crus helix. This is the inferior crus. And this is the superior crus of the antihelix. This depression or the groove between the helix and the antihelix is known as scapha. Scapha is written there. This part is known as the concha. This entire depression is known as concha. And the crus of the helix divides the concha into two parts. Upper half, which is the Simba conchi, and the lower part, which is the cavum conchi. And cavum conchi is where the meatus is opening up. Okay. This part, I think everyone knows, this is the tragus. Anteriorly is the tragus, posteriorly is the antitragus. And this part is a lobule. Okay. Now I'll look at the actual ear and identifying the various anatomical names, because I will be telling you what is located where. So you have to remember this. Can I proceed? You are looking lost. Okay, so we come to the lobule first. One of the easiest thing to remember is the lobule. All you need to do is divide it into 9 parts. Okay, if it is a square, consider 9 equal parts. So posteriorly, right in the center, you'll find is the eye. Easy to remember. This is where normally the girls get their ears pierced, right in the center. And if you look at your homes, your grannies, they always used to say, "Bachche ke kaan chida do, aankheं theek rahengi." जाके पूछना, नानी दादी से पूछना घर में, क्यों चिल्लाना है, अभी क्यों चिल्लाना है, क्या करना है, आंखें ठीक रहती हैं, दे विल टेल यू. Okay, now we know there is a scientific reason for it. Eye is situated, eye point is situated right there. There are other eye points also will come. Now the tonsil is below the eye. Now remember, inverted fetus. इसलिए आपको लगता है टॉन्सिल तो आंख के नीचे होता है, ऊपर कैसे, ऊपर होता है, नीचे कैसे चला गया, यहाँ पे नीचे कैसे चला गया, इन्वर्टेड है इसलिए नीचे चला गया टॉन्सिल, और टंग आई के ऊपर आ गया. ठीक है. नाउ दिस एरिया इज द एनेस्थेटिक पॉइंट फॉर द जॉ और द टीथ. ऊपर वाला फॉर द अपर टीथ, लोअर फॉर द लोअर टीथ. Little discrepancy in your book, in the book that you are going to read. It says the lower half of this top area is for the lower teeth and the upper half is for the upper teeth. Okay? But we were taught that this is part is the lower teeth and this is the upper teeth. So whichever, so different books may give a slightly different, but they are already adjacent areas, so it makes no difference. And the posterior most part is the internal ear. ये खाली है, ये खाली है. Anterior lowermost and posterior uppermost part is khali. Remember, we are talking about this is anterior, this is posterior. Okay? बताइए anterior में क्या होता है? आई के anterior में क्या है? Okay. उसके ऊपर, आई के ऊपर नीचे टॉन्सिल है, और पीछे इंटरनल ईयर है. Now the lobule is over, this part is over, this much is clear. Now I will come to this part, all the points concentrated in this small little area. Okay. Now you can imagine this is the tragus, and this is a point on the inferior part, post part of the tubercle. This is the adrenal point. Okay. I'll come to. Let me go on to the next one here. So this point becomes the adrenal point. Okay. Just along the margins of the lobe. This is the intertrachic notch. This is called the intertrachic notch. Tragus and the antitragus के बीच में ये notch है. आगे जो है वो I1 है, पीछे जो है वो I2 है. Just at the margins where the notch is curving. And on the inner surface, कान के अंदर, just adjacent to the margin is the endocrine. Is the endocrine. Okay? Adjacent to endocrine, below the meatus, is the sanjiao. What is sanjiao? Which cavities? Orbital cavities. Sun. Sun. What is sun? Sun means three cavities, three. So three cavities. Which three cavities? Thoracic, abdominal, pelvic. Okay. So all the three cavities are represented in this area, just posterior to the external auditory meatus lie the lung and the heart. So just imagine there is one lung here, one lung here. Okay, and in between the two will be the heart. Okay. Now this is important because you might be using these areas very commonly. On the antitragus, the tubercle at the tip is the Dingchuan point. What is Dingchuan? Where is the body Dingchuan? We have done it very recently, only yesterday. तुमो चैनल कब किया था? कल किया था. Where is Dingchuan? What does it mean? Asthma relief. Asthma relief point. अस्थमा रिलीफ पॉइंट के नीचे एकदम होता है area which is for the testes and the ovaries. This again is not on the external surface, but on the internal surface, on the medial surface. Okay. But here I have to show it on the external surface, otherwise I can't show it. And little below, just little behind and above the I2 point is the forehead area. इतना समझ में आ रहा है? ये थोड़ा बहुत आपको रटना पड़ेगा, उसके बाद जब आप फीटस का ध्यान रखोगे तब आपको समझ आ जाएगा कि फोरहेड वहां पे क्यों आया, क्योंकि उसका एक्चुअली इन्वर्टेड फीटस का फोरहेड उधर ही है. Now here again there are two areas just anterior to the tragus, the external and the internal nose. Okay. Now actually the external nose is on the external surface, internal nose is on the medial surface, inner surface. And just at the level of external auditory meatus comes the pharynx. Pharynx is also on the medial surface, not on the external surface. Okay. Now, one point that is not represented here, between the adrenal and the pharynx, there is another very interesting area which is gaining popularity nowadays. Appetite point. Okay, it's being used for curbing appetite, for treatment of obesity. Weight Watchers can also use it. Okay. Do I need to repeat? Or can I proceed? My dear friend here, are you with us? Are you with us? Sure. अच्छा, very nice. ये बताओ ये कौन सा point है? Very good. This one? Let him. This one? Okay, anyone. Let's not waste time. We're running late. So I2, I1, endocrine, Sanjiao, lungs and the heart, adrenal के पीछे यहाँ पे आ जाएगा एक्सटर्नल ईयर, इनर सरफेस में चला जाएगा इंटरनल ईयर, उसके ऊपर जस्ट anterior to the meatus. On the inner side will be the pharynx. And on the margin between the pharynx and the adrenal is the appetite suppression point. Okay? Okay? And this point refers to the ovary or the testes. Revision. Jaldi se batao. I'm sorry, I will juggle and go aage piche so that you know you revise. I want to keep myself awake. Very good. Good. These points we have just now actually revised. अभी रिवाइज किया ना, फिर से कर लेंगे बाद में. थोड़ा और ऊपर चलते हैं. Now this part, what was this? ये क्या चीज थी? Crus of the helix. Now this actually divides the concha into sigma and the cavum conchae, but it also divides the body. So this crus represents the diaphragm. Okay. So anything above the level of diaphragm will come below this, and everything below will come above this. Okay. So this red dot that I have said represents the diaphragm, और इसके नीचे जो है हमने कहा था यहाँ पे inner surface से pharynx था. The mouth and the gut will go and curve around the crus of the helix. So the entire gut will be curving around like this. Is that clear? Now let us look at, yeah. Fine. So the mouth comes here. Pharynx was somewhere here on the inner surface. Mouth comes here. Esophagus comes here. This part is the esophagus. This is the cardiac orifice. Okay, then the stomach comes just at the point of the crust, followed by duodenum around after curving around the crust, then the small intestine and the large intestine. याद आ जाएगा? ठीक है? Don't remember, just have to remember यहाँ से gut जो है, mouth onwards, everything is getting curved. Stomach comes here at the tip. तो obviously ऊपर क्या जाएगा? Duodenum, small intestine, large intestine. ठीक है? अब stomach के साथ यहाँ पे on just adjacent to the stomach, posterior to it comes the liver. Okay. And a little above here, corresponding more or less to the duodenum, comes the pancreas and the gallbladder. Now here is an interesting thing. Pancreas is supposedly represented in one ear, gallbladder in the other ear. They are not both represented in both sides. Okay. So left side में pancreas बोलते हैं, right side में gallbladder बोलते हैं. लेकिन location वही है. It's the same location. Okay. Now, लार्ज कट के एकदम ऊपर सिम्बा कॉन्के के ऊपर हाफ मार्जिन में यूरिनरी ब्लैडर आती है और स्मॉल इंटेस्टाइन के ऊपर किडनी आती है. स्मॉल इंटेस्टाइन के ऊपर किडनी आ जाएगी और ये सब सिम्बा कॉन्की में है. इफ यू डिवाइड सिम्बा कॉन्की इनटू टू अपर हाफ्स एंड लोअर हाफ्स, किडनी ऊपर जाएगा, स्मॉल इंटेस्टाइन नीचे आएगी, ब्लैडर ऊपर जाएगा, लार्ज इंटेस्टाइन नीचे आएगी. ओके. एंड ऑन द thus as it is between the helix, यहाँ पे आपके आ जाएंगे external genitalia and the urethra. Just where the diaphragm is ending is the area for the urethra, and a little above is the area for external genitalia. ठीक है? This I've already told you. Now we come to an interesting area, which is the triangular fossa. This is called the triangular fossa, which is bound on one side by the helix and on the other two sides by the superior and the inferior crest of antihelix. Okay. There are some very interesting points here which we will be using and which I'll also be demonstrating besides some of the other points. If you read your book, usme this has been marked as surface 1. This has been marked as surface 2 and this has been marked as surface 3. And the points are given in relation to surface 1, surface 2, surface 3. But just remember, surface 2 is nothing but superior crust of antihelix. Surface 3 is inferior crust of antihelix. And surface 1 is the helix. Okay? Don't get confused because when I tried to read it to explain you, because that is the book you have been prescribed, I also got confused. Ye kya bol raha hai? Then I realized it is nothing but the nomenclature. So right in the center is the area for the uterus and seminal vesicles. Right in the center of triangular fossa. You will have lots of patients coming with dysmenorrhea. You just have to put a finger there and give a little pressure. Try it out someday. At the angle is an important point which is called the ear Shenmen. What is Shenmen? What does Shenmen mean and where is the body Shenmen? ये ear Shenmen की बात हो रही है. Any volunteers? Okay. Where is heart 7? Anyway, this is the Shenmen here. Shenmen. Heart 7 is on the wrist crease, just radial to the pisiform bone on the distal wrist crease. Another interesting point is the sympathetic nerve or the chaukan. We call it the chaukan, just at the junction of the crust of the inferior crust and the helix. Okay, sympathetic nerve. In addition, there is a hot point. Hot point is nothing but if you draw, you see superior helix is coming like this, inferior helix is coming like this. They are curved if you look at the ear. So if you drop off tangents, wherever the tangents are meeting on the antihelix, that point is called the hot point. Hot point means it brings down the fever. If you stimulate this point, it brings down the fever. Okay. Now this is pretty useful for those children where you have given paracetamol and they are not responding. Even adults, nowadays there are paraxias which just don't respond, and then you don't know what to do. Try stimulating this point along with your paracetamol, and you will find dramatic relief. Okay, now we are revising this. Who will tell us the points? ये क्या था? Good.
Stomach.
Gallbladder and pancreas.
Gallbladder.
Fun. Urethra, correct. This is very good. Garden style. Good now. Correct. Lower esophageal sphincter. Esophagus. कहाँ चला गया? And this entire area, ये dot रखा रहा है to point it. This entire area is the diaphragm. Very good. Now we come okay. This part we have not yet done. Now we come to the rest. We talked about the triangular fossa, isn't it? I have told you this is the uterus and the seminal vesicles. This was the Shenmen, and this was the ear sympathetic. Ear sympathetic. Now we come to the rest of the antihelix. Now the antihelix is till this point represented by the lower lips. Okay. So topmost area is occupied by the toes, then the ankles, and at the angle of the triangular fossa comes the knee. And now the whole spine is getting twisted. तो यहाँ पे आ जाता है abdomen और आपके buttocks चले जाते हैं पीछे और बटक के पीछे चला जाता है pelvis and the hip और इसके adjacent just along the superior margin of the inferior crust comes the sciatic nerve. Is it clear? Not difficult? Is it difficult? I repeat, toes come at the uppermost part of the antihelix crust, superior crust, followed by ankle. At the angle comes the knee. And then यहाँ से spine आपकी घूम रही है, pelvis आपकी यहाँ पे आ गई, ठीक है? और hip joint पीछे चला गया और hip joint के साथ sciatic nerve उसके ऊपर आ गई, ठीक है? Now abdomen हमने कहा था इधर आ रहा है in this wide area and the rest of the spine is coming down. So first is the lumbosacral spine, followed by the thoracic spine and the cervical spine. And cervical spine के नीचे where actually यहाँ पे क्या होना चाहिए? एंटीट्रेगस. यहाँ पे एंटीट्रेगस होना चाहिए. तो एंटीट्रेगस में ही चला जाता है, डिंगचुआन के अंदर की तरफ चला जाता है, द ब्रेन पॉइंट एंड द ब्रेन स्टेम. Okay, brain stem and the brain point goes on the inner surface of the antitragus, where the antitragus is meeting the antihelix. Is that clear? Now, once this picture is clear, it will be easier to remember कि जहां पे toes हैं, वहीं पे fingers हैं. जहां पे ankle है, वहीं पे यहाँ पे इसके साथ में यहाँ पे आ जाएगा wrist. जहां पे knee है, यहाँ पे आ जाएगा elbow. ठीक है? So this is what it's going to look like. Now, shoulder is coming just at the junction of, I told you, यहाँ पे आ जाता है. क्या आ गया था यहाँ पे? यहाँ पे एब्डोमेन था. यहाँ पे सर्वाइकल स्पाइन थी. सर्वाइकल स्पाइन, सॉरी, लंबोसेक्रल स्पाइन. यहाँ पे thoracic स्पाइन. तो thoracic स्पाइन के लेवल पे, जिस वे द thoracic स्पाइन इज गोइंग टू मीट द सर्वाइकल स्पाइन, उस लेवल पे शोल्डर आ जाता है. ठीक है? सर्वाइकल स्पाइन corresponds to the neck area. Now all this is in the scapha. The spine as well as the lower limb till the level of knees was on the antihelix. The buttocks and the pelvis went on to the inferior crest of antihelix. They turned, isn't it? And the corresponding areas on the scapha represents the fingers, the toes, representing corresponding to the toes, wrist corresponding to the ankle, elbow corresponding to the knee, and then lumbosacral spine के साथ नीचे, उसके नीचे सर्वाइकल thoracic spine के साथ शोल्डर, और उसके नीचे सर्वाइकल स्पाइन के साथ नेक. और नेक के नीचे आई टोल्ड यू यहाँ पे आ जाता है ब्रेन स्टेम, एंड ब्रेन स्टेम के नीचे the brain point, which is on the inner surface of the margin. Okay. Then we have two other areas on the back of the ear. If you see the back of the ear, there is a groove. जो लोग मास्टोइडेक्टमी कराते हैं उन सबको दिखाई देता है बड़े अच्छे से. मास्टोइडेक्टमी कराइए सबने, देखा ही नहीं होगा, स्क्रीन लग जाता ना आजकल. नहीं, दूसरी तरफ नहीं जाते. हमारे पास लगता है. We move to the opposite. Okay, so anyway, so this groove is for control of blood pressure. A 3-edged needle is prescribed, and you are supposed to cause puncture to cause bleeding. Okay? That supposedly decreases the blood pressure within minutes. And this entire area is representing the back. ऊपर upper back, बीच में middle back, and नीचे lower back. ठीक है? Or just behind the mid back, this is the area represented by the vagus. This I have already told you. That's a repetition. So actually, there are two hunger points. One is what I told you. Okay? And one is between the mouth and the lower border of the crust. Okay? This one I already told you. This one I did not tell you. So this is there between the mouth and the lower border of the crust helix. So both of these points, they're very close to each other. So even if you pinch that area between your thumb and the finger, you will hopefully suppress the appetite. So that in a nutshell is the entire ear. Now, what all you need to do? First of all, this is one area where you really need to clean properly. Little difficult to access, so you need to clean properly. Better to use retention needles. But if you need to prick, don't use more than half an inch long needle, because you are not supposed to puncture the cartilage. Just puncture the skin. And the needle has to be horizontal to the surface where you are pricking. Idea is again to avoid the cartilage underneath. Okay? Another thing is mentioned, the outer surface, what we see here. This is the yang surface and this is the yin surface. Piche wala is the yin surface. So it is advocated that you don't stimulate the anterior and the posterior surface of the same ear. Please remember, same ear together. But that is not true for the opposite ear. Okay. Now, before I go on to scalp areas, I would like to demonstrate on you the various things we have talked about. And hopefully, you will demonstrate on each other. Yes. More everything can come and see. Need to this is one area. Nothing enough to go.
You can follow my camera.
Helix, lobule, antihelix, superior crest of antihelix, inferior crest of antihelix. This is the concha, Simba concha, Cavam concha. This is the tragus, this is the antihelix.
The one who
Somebody else. Come on. Repeat.
So and Simba
Antitragus.
antitragus
Scapha.
and scapha is this.
This is scapha. And where is the triangular fossa? Correct. That is a triangular fossa. Okay. This is the triangle. This is the triangle. This is the triangular.
This is where your Shinman is going to be.
ओके ये जो स्टड पड़ा हुआ है बिल्कुल आई पॉइंट पे पड़ा हुआ है ठीक है इसके ऊपर यहाँ पे आएगा टांग नीचे जाएगी ट्रांसलरी पीछे इंटरनल ईयर है और यहाँ पे कुछ नहीं है इधर कुछ नहीं है और ये एरिया फॉर द टीथ ठीक है ओके नाउ आई कम टू द इंटरट्रेगिक नॉच दिस इज द इंटरट्रेगिक नॉच यहाँ पे I1 है यहाँ पे I2 है and this surface inside and you see this surface inside that is an endocrine area. This surface here is the Sanjiao. ये आपका meatus है तो यहाँ पे एक लंग है यहाँ पे दूसरा लंग है और इन दोनों के बीच में हार्ट है किसी को समझ में नहीं आए तो you can interrupt, we can repeat. We come to the tragus. ट्रेगस में क्या है सबसे इंपॉर्टेंट पॉइंट? एड्रीनल पॉइंट. एड्रीनल के इस तरफ क्या आ जाता है? दिस एरिया इज एक्सटर्नल ईयर, इसके इनसाइड इज द इंटरनल ईयर. यहां पे आ जाता है पैरिंग्स. अब यहाँ पे ये जो क्रस है यहाँ पे बन जाती है डायफ्राम. अलोंग दिस एरिया हियर इज द ईसोफेगस, कार्डियक स्फिंक्टर. यहाँ पे आ गया स्टमक, यहाँ पे आ गया डोडेनम, स्मॉल इंटेस्टाइन, लार्ज इंटेस्टाइन. लार्ज इंटेस्टाइन के ऊपर क्या था? यूरिनरी ब्लैडर. स्मॉल इंटेस्टाइन के ऊपर क्या था? किडनी. ठीक है. और यहाँ पे क्या था इसके साथ, स्टमक के साथ? यहाँ पे क्या था? लिवर. यहाँ पे था लिवर. और डुओडेनम स्मॉल इंटेस्टाइन के ऊपर यहाँ पे क्या था? पैनक्रियास एंड गॉल ब्लैडर. लेफ्ट साइड में पैनक्रियास बोलेंगे, राइट साइड में गॉल ब्लैडर बोलेंगे. सब बुक्स हैव मेंशन लिवर पॉइंट के नीचे स्प्लीन होता है. ठीक है. Now we come to the triangular fossa here. Triangular fossa here, just at the junction of the superior and the inferior crust. This point is the Shenmel. This one in the center is the uterus and the seminal vesicles. And this point here, just this point here, where the crust crosses over the inferior helix, this point is the Chaukan. Okay? Now what is lying here on the superior crust? The toes, ankle. यहाँ पे ट्रायंगल फसा के एपेक्स पे यहाँ पे आ जाता है नी. इसके बाद बॉडी यहाँ से टर्न कर गई, बटक्स यहाँ पे आ गए, इसके पीछे चला गया, इधर क्या आ गया? पेल्विस. पेल्विस एंड द हिप जॉइंट. और इसके ऊपर यहाँ पे क्या आ गया? साइटिक नर्व. सो फार सो गुड. अब स्काफा में चलते हैं. यहाँ से चला जाएगा, यहाँ पे आ गया फिंगर्स, रिस्ट, एल्बो. शोल्डर नीचे जाएगा, स्काफा में नीचे जाएगा, क्योंकि यहाँ पे अब आप क्या आ गई? यहाँ पे आ गया था एब्डोमेन. नीज के आगे थोड़ा आ गया था एब्डोमेन. उसके नीचे आ गई थी लंबोसेक्रल स्पाइन. यहाँ पे आ गई थी थोरैसिक स्पाइन. और यहाँ पे आ गई थी सर्वाइकल स्पाइन. ठीक है ना. तो यहाँ पे आपकी जो स्पाइन थी, शोल्डर आपका इधर आएगा. दिस पॉइंट विल बिकम द शोल्डर एंड द नेक विल कम दिस साइड. और यहाँ पे एंटीट्रेकस था. एंटीट्रेकस में डिंगचुआन इज द मोस्ट इंपॉर्टेंट पॉइंट. डिंगचुआन. डिंगचुआन के बिल्कुल यहाँ पे आ जाता है ब्रेन स्टेम, और यहाँ पे नीचे आ जाता है ब्रेन पॉइंट हियर ऑन द इनर साइड. ठीक है. डिंगचुआन के नीचे क्या था? यहाँ पे टेस्टिस एंड द ओवरीज. ओके. और यहाँ पे नीचे उनके यहाँ पे इस एरिया में आ जाता है द फोरहेड. जस्ट रिमेंबर, नेक तो यहाँ पे थी आपकी, यहाँ पे आ गया था आपका फोरहेड. ठीक है. इतना याद आ गया. हंगर पॉइंट कहाँ थे? हंगर या एपिटाइट सेपरेशन पॉइंट्स, एक तो मैंने बोला था यहाँ पे है, और एक फैरिंग्स जहाँ पे ऊपर जाता है यहाँ पे है. तो इफ यू जस्ट हैव टू pinch this area, you will be stimulating not only the hunger point but other points also. Doesn't matter, they don't do any harm, but they stimulate the hunger point. And the hot point, where is the hot point? ये आ गया आपका सुपीरियर हेल क्रस, ये इंफीरियर क्रस. यहाँ से आप टेंजेंट ड्रॉ करेंगे, यहाँ पे मीट करते हैं. दिस एक्चुअली लाइज बिटवीन द नीज एंड द एब्डोमेन. राइट. सबको समझ आ गया? आ गया? आ गया? रिपीट.
कौन से इसके कौन से पॉइंट्स हैं?
Now
यहाँ से
somebody
ये
else please sit so that she can also see.
या बट सर ये कौन से पॉइंट्स बताओ.
हाँ बताइए.
Okay, what are the points? देखो कौन से पॉइंट्स हैं. आई तो है ही है, she is not wearing it there. What else? Forehead है. Yes. Come here na, come here and see.
Interestingly, many people have advised people who have recurrent migraines to pierce the forehead area. Ding Chuan is often pierced for asthma.
I got one of the sisters who was having this problem, जिसको relief मिला था. I advised her to get it pierced. Now again, she is only on single inhaler now.
These are all the practical experiences, which will enrich you and also.
Yeah, what is this point?
बताओ ना, अभी तो बोला. बताइए कहाँ पे है?
कहाँ पे?
Correct. Correct.
Fingers ऊपर है. Fingers
Wrist
के
भी
बाद
ऊपर है.
wrist भी ऊपर है. Fingers, wrist, elbow. So somewhere between wrist and elbow.
ठीक है.
You got it for fashion or was it some?
This was for headache. This was
Huh.
for fashion.
See, here is a living example. Practicing acupuncture.
You
may
have
not have
also
practiced.
you also have got it at forehead.
Just that.
Okay, now you haven't seen.
Okay,
Who was
you
that?
haven't seen.
Somebody has not seen. Let us see.
Hello.
And somebody else can volunteer, and another volunteer to show and revise.
Hello. Yuri bhai. So no. Okay. You tell the points. बैठो क्षितिज. सो ना.
अच्छा एक मिनट. आप इधर आके बताइए, उसी तरह बताइए. Because it's confusing.
Yeah, it's confusing. Yeah. So you take the needle, na? Can you please pin my video so that it can be recorded also?
Use the same needle.
Dropped it, sir.
अच्छा you drop. जिन्होंने पहले अच्छे से नहीं देखा वो आगे आ जाए.
Try.
First we'll begin with lobule, most simple part where we get pierced is eye.
I.
Over we have tongue and niche tonsil. Anteriorly we have upper tooth and lower tooth. Feature we have internal layer on the lobule. Then we begin.
See, the shape of the ear also changes. Okay.
Tragus, we have adrenal point.
Right at the triggers.
Adrenal point.
Adrenal point. Yes.
And pharynx.
Yes.
Endocrine point.
Endocrine point.
Is the internal.
Endocrine point कहाँ पे होता है? No. Intertracheal notch के interior. So it will be somewhere. Just a minute. Endocrine point will be here on the inside, on the internal side. बारी बारी से चलो ना. Intertracheal notch पे कौन कौन से होंगे? It's difficult for me to tell because I'm focusing the camera. Yuri, would you like to attempt?
Sure.
Come this side. Come this side.
At the notch and the internal part is kind of prime pointed,
Right.
and then this part will be I1 and I2.
नीचे. नीचे. See, it's
क्या पे?
just where the U shaped. And just give it to me. Yeah. Okay. So if you go here, right, and here. Okay. So that will be your right. Now, again, continue, Yuri.
Place the cut.
Place the cut.
So the gut starts from first is so it has to be
The mouth.
on the mouth say.
This will be
This-
duodenum. No?
Mm.
So somewhere.
Mouth will be somewhere else.
Mm.
And after that, mouth
Mouth will be just where the crus is beginning,
Mhm.
joining, where the crus is joining the helix.
यहाँ पे होगा ना then.
देखो एड्रिनल के ऊपर का फारिंग्स, इनर सरफेस का फारिंग्स था, फारिंग्स के साथ माउथ होगा। उसके बाद जिसपे के शुरू हो जाएगा along the lower border of crus.
So इसके ear shape, that is right. Ear shape is different.
No, इसलिए मैंने बोला था
इसलिए,
दोनों
हाँ.
दोनों तरफ करने से जरा ज्यादा अच्छी बनती है पिक्चर।
His ear shape is also slightly different, sir. Ear shape is slightly different, sir.
No, it doesn't matter.
Yeah.
This is the tragus.
Yeah.
So here was your pharynx.
Yes.
ठीक है, यहाँ पे माउथ हो गया, यहाँ पे क्या आ गया, इसोफेगस। इसोफेगस के बाद यहाँ पे आ गया कार्डियक स्फिंक्टर, यहाँ पे आ गया स्टमक। अब यहाँ से ऐसे टर्न करेगा।
Exactly.
यहाँ से ऐसे टर्न करेगा। ठीक है, यहाँ पे स्टमक था तो यहाँ पे डुओडेनम आ गया, यहाँ पे स्मॉल इंटेस्टाइन आ गया, यहाँ पे लार्ज इंटेस्टाइन आ गया, और यहीं पे ऊपर क्या चला जाएगा, लार्ज इंटेस्टाइन के ऊपर
लार्ज के ऊपर यूरिनरी ब्लैडर,
यहाँ पे किडनी,
Kidney.
है ना।
Then you will have the which gallbladder or pancreas here? Right is gallbladder.
लिवर विल बी राइट
Liver
हियर,
will be here.
विल बी राइट हियर, स्टमक के साथ।
Stomach के साथ liver होगा ना?
ठीक है, तो क्या मुश्किल था? Get used to the looking, peering into the people's ears. Okay. Now this was, what was this? This point?
Xingchuan.
Xingchuan. Very good. Xingchuan. This one?
Adrenal.
Very good. This point? This point? Anjao. यहाँ पे आ जाओगे, this is the lung, the heart. Okay. This part should be easy. Shenmen. This is Chaukan, intraceptional vesicle. Okay. अच्छा, यहाँ पे हमने क्या बोला था? कट। तो कट जहाँ पे वो टर्न कर रहा है, यहाँ पे कट कर रहा है, तो यहाँ पे क्या आ गया? स्टमक के नीचे था ना, बटक्स कहाँ गए? टर्न किया, कहाँ से टर्न करता है? स्टमक, है ना। उसके बाद उसके ऊपर यहाँ पे आ जाता है पेल्विस, पेल्विस के नीचे ऊपर चल, यहाँ पे चला जाता है हिप जॉइंट, हिप जॉइंट के ऊपर यहाँ पे आ जाती है sciatic. ठीक है, विच इज ऑन द इंफीरियर क्रस ऑफ एंटी हेलिक्स। ठीक है, अब यहाँ पे क्या आ गया? करेक्ट, ऊपर जाएगा टोस, एंकल, नी, और इसके नीचे यहाँ पे क्या आ गया? ब्रेन स्टेम पॉइंट अंदर चला गया, इसके नीचे ब्रेन पॉइंट, और यहाँ पे आ गया आपका अपर लिप, फिंगर्स, wrists, यहाँ पे elbow, shoulder will come here, forehead will come here. Okay. Who wants to reflect few points quickly, just for demonstration of how to do it? Half-inch needle. No
So we have
volunteers.
happened.
Volunteer.
Can someone please show it?
और उसके भी इधर चले जाओ, यहाँ पे वेगस के ब्रांचेस वहीं से अंदर जा दिया है, ऑरिकुलर नोड्स। नो वन एंड यस, जल्दी छुट्टी हो। नो वन एंड यस,
बैठो ऐसे.
डू आई हैव योर परमिशन? मुझे नहीं तो फांसी से लगा दोगे ना। इन्फॉर्म कंसेंट। Alright.
Let us stop it. Anyone wants to have extra tea, you can have it.
It is about in our
Cancer. Hopefully we have. I don't know whether it's closed or not. I don't know. I miss it. Okay.
Half inch needle, please.
Half inch. Yes, I've kept it here. It's the bottom. Cotton soap, beta. There were cotton soap there, na? Sir, ये. Cotton soap है. वो नहीं. सर वो एनएमसी के चक्कर में है ना. Everything has been cleaned off. हाँ. Everything has been cleaned off. Earbud.
Since more than one area has been bathed, I can put in more than 1 meter.
All his ailments will go.
Now, I will first of all, these are superficial areas where you can find only using the picture correctly. I'll show you the inner areas. For example, the different those areas. For example, the somebody has said endocrine. Endocrine is what is another? Here, I need to expose this area. Endocrine is just here. I just I have not punctured the part, just under the skin. What's the anticipated? I have your position. The Chenman. Rather, I think I will show you the simple thing. Chenman is very easy. It is a simple. See? Angular pattern is नीचे inferior plus or ये sympathetic होता है. अगर ठीक से नहीं गई होती तो needle गिर जाती. Needle is properly placed, so needle is remaining. And please note, make a note that the needles are parallel to the skin surface, almost parallel to the skin surface. Horizontal. Okay. Thank you. I think the rest we can do on 29th. If they
Yes,
want.
sir.
You know.
तो आप कैसे जाओगे सर?
We come to the scalp areas. After year, I think you might find the scalp areas a little easy. Now, before we begin with the scalp areas, you will have to learn some imaginary lines. Okay. One is the antero-posterior line. Antero-posterior line begins in right in front. It's in the sagittal plane, right in between the eyebrows at the nasion level. It goes posteriorly, right over the midline, over your scalp, over the head, and ends just at the intersection of the line joining the two occipital buckles. Okay, that is the AP line. Another line is the eyebrow occipital line. That means the midpoint of the eyebrows goes laterally along your head to end at the midpoint between the two occipital protuberances or the tubercles. Okay. Now everything is in relation to these two lines and how they intersect others. If you look at the first A point, that is the midpoint of the AP line, or is say 0.5 centimeter. Now please remember, now here we are using centimeters, everywhere else we use soon. Everywhere else on the body we are using shun. Here we are using centimeters. So 0.5 centimeters behind, you drop a perpendicular laterally where it should intersect the eyebrow occipital line at the level of the hairline. Okay. Little difficult in males, particularly with receding hairline. Easier to understand in females. Okay. So you have to anticipate or imagine where the male hairline may be in a balding person like me. Okay. So wherever this is intersecting, now that line from 0.5 centimeters behind the AP line to the hairline at the point where hairline is intersected by the occipital eyebrow line. That is called the motor area. If you imagine, actually it lies over the gray matter controlling the motor areas. Okay. Now this is divided into 5 equal parts. Upper 1/5 represents the lower limb, middle 2/5 the upper limb, and the lower 2/5 represents the head and neck area. Okay. Now please remember, these areas represent the opposite side. We know from our anatomy that tracks are crossing over, isn't it? So these areas are representing the opposite side. And where do you stimulate them? You can stimulate them for all upper motor neuron problems, right? Hemiplegias, hemiparesis, just motor weakness, aphasias. But here is a catch. Most of the times, these patients may not come to you. And this has best effect if started early. They or within a few days of the onset of the hemiparesis or hemiplegia or aphasia. If you institute this treatment, recovery is much faster. Recovery will not be so good if you start the treatment late. Because earlier, the people will obviously try allopathy and other things. And if they don't work, then they might come for alternative means. But if this is done along with allopathic means, we don't need to take the credit, but you will find that the patients are known to recover faster. Now, sensory area is behind. How much behind? 1 centimeter behind this. Again, a parallel line, parallel to the motor area, intersecting at the hairline. Again, divided into 5 parts, equal parts. Upper 1/5 representing middle 2/3 upper limb. Again, lowest 2/5, lowest 2/5 representing the head and neck area. Again, opposite side, not the same side. This can be used for all kinds of sensory deficits. Right? Head and neck area, particularly for trigeminal neuralgias. Then there is a tremor area. Tremor area lies anterior to the motor area. Tremors of any cause, baby chorioathetosis, could be even alcoholic tremors or Parkinsonism, any kind of tremors, this area can be stimulated, and this area lies 1.5 centimeters in front and parallel to the motor area. Sensory area was 1 centimeter behind. So this is 1.5 centimeter in front of the motor area. Okay. So actually it is 1 centimeter in front of the midpoint of AP line. Just to confuse you. Motor area was 0.5 centimeters behind. Or here 1.5 centimeters anterior. This means it is 1 centimeter anterior to the midpoint. Okay. Again, opposite side. Then there is one more area, which is the vasomotor area, which is again 1.5 centimeters anterior and parallel to the tremor area. Okay. Vasomotor areas are used for vasospastic conditions, Raynaud's phenomenon or a Burgess disease. Again, opposite side, not the same side. Now, speech area, we told you motor area, जो lowest 1/5, 2/5 होता है, that is also known as speech area 1. Motor area for head and neck area, which includes the tongue, that is called the speech area 1. Now we come to speech area 2. Speech area 2 is look for the highest point of the pinna, apex of the pinna. वहां पे कौन सा पॉइंट होता है? सांजिया चैनल का कौन सा पॉइंट होता है? ये मैंने सांजिया भी बोल दिया. Before the सांजिया dips down in front to ended tragus, कौन सा पॉइंट होता है? 20 नीचे जाके 21 बन जाता है. ठीक है. Okay. So you draw a line 4 centimeters long from, I'm sorry, पिन्ना की बात नहीं कर रहे हैं. पिन्ना में दूसरा auditory area आता है. Speech area 2 is the parietal tubercle. If you look at the parietal tubercle, you have to look for the posterior inferior point of the parietal tubercle and draw a line which is 4 centimeters long, running parallel to the AP line. That becomes your speech area 2 for all speech problems. Now, auditory area, this is at the pinna, tip of the pinna, and this response corresponds to also the speech area 3. One was in the motor area, lowest 2/3, lowest 2/5. Second was the line drawn from posterior inferior tubercle, parietal tubercle. That was speech area 2. Now this is speech area 3 and auditory area. Auditory area is actually from the midpoint, 1.5 centimeters above the apex of the pinna. You draw a 4 centimeter line. 2 centimeters extending anteriorly, 2 centimeters extending posteriorly. Okay. With the midpoint being 1.5 centimeters above the apex of pinna. This becomes the auditory area. Now, if this line is extended posteriorly for another 2 centimeters, then it becomes a 6 centimeter line. Iska posterior 4 centimeters becomes speech area 3. Okay. So the middle 2 centimeters, they are common to both auditory as well as speech areas. Okay. Anterior 4 centimeters of the 6 centimeters becomes auditory area. Posterior 4 centimeters of the 6 centimeter line becomes the speech area 3. And the middle 2 centimeters are common to both auditory and the speech area. Okay. Now this can be For all ear problems, tinnitus, Meniere's problems, vertigos, deafness, as well as sensory aphasia. So you can stimulate these points. Then another foot motor area is parallel to the AP line. And this is just about 1 centimeter lateral, beginning from the midpoint, 1 centimeter lateral, extending for about 6 centimeters, 3 centimeters anteriorly, 3 centimeters posteriorly. So this is called the foot motor sensory area. Okay? So sensory motor deficiencies of the opposite foot. Then we have some points in front of the forehead and some points on the back. Gastric area, the thoracic area, and the reproduction or the genital areas. Gastric area is right in the midline. In a forward gaze, look for the pupil. In line with the pupil, mark the point on the middle of the eyebrow, and then you have to have a 2 centimeter line drawn vertically up from the midpoint of the eyebrow, beginning at the hairline. So you'll be actually drawing a line from here, but not counting the lower half. You will be counting the 2 centimeters after you have crossed the hairline. So hairline and above, 2 centimeters. That becomes the gastric area. That can be stimulated in all gastric problems. Distensions, acidities, ulcers. Okay. Thoracic area is midway between AP line and the gastric line. Just the midpoint. If you look at the AP line and the gastric line, midpoint from the hairline, now 2 centimeters above and 2 centimeters below the hairline. Okay? This becomes the thoracic area for all chesty problems, including some problems of the heart, particularly palpitations. Okay. Now here we normally palpitations of the nervous origin. Genital area is lateral to the gastric area, where the angle of the hairline seems to dip. Okay, from here you go again vertically 2 centimeters long and parallel to the gastric area. So this can be used for all pelvic problems in females, and in males, impotence and spermatoria and erectile dysfunctions. So this area can be used. Posteriorly, again we have got areas, the visual area and the balance area. So they are also parallel to the AP line, and the points are taken from the eyebrow occipital line. So the visual area is nothing but a 4 centimeter line, 1 centimeter lateral to the midpoint of the two occipital protuberances, where the AP line is intersecting the eyebrow occipital line. Okay, it is extending up, and for all visual disturbances, particularly of the cortical origin. Okay, so eye problems. And the balance area, this is also a 4 centimeters line, but it is 3.5 centimeters lateral to the midpoint of the occipital protuberances on the eyebrow occipital line. Okay, and for any problem with equilibrium, particularly of cerebellar origin. Okay, so this is what is known as a balance area and can be stimulated for people who have balance problems. Very important area, the usage area. This is called the usage area. This is again from the most prominent point of the parietal from tubercle. Now you have to draw two lines. Two lines going down towards the pinna, but forming an angle of 45 degrees. Your books mention 40 degrees. Okay. Other books mention 45 degrees. So 40 to 45 degrees, if you say, after all, it's an area, so you need not be very, very accurate. This is called the usage area. Okay. For insomnia. बच्चों को माँ कैसे सुलाती है? ऐसे ऐसे करके. कभी बच्चे को सुलाया किसी ने? हाँ. Don't they do this? Have you ever seen? Or they do just this. Soja, soja. Keep on tapping gently, don't they? They are actually stimulating this area, the usage area. This is also meant to enhance the memory. Don't the teachers scold the children? सोचो, सोचते क्यों नहीं हो? बोलते हैं ना? This is again memory area, usage area. Okay. Now you need to again remember that there is a scalp underneath, so all needles have to be horizontally placed, and you need to have a long needle because the area, of course, if you are trying to use lower 2/3, lower 2/5, you need not use a very long needle because you are only trying to use the head and neck area. But if you want, if it is a hemiplegia, पूरा का पूरा motor area आपको पूरा का पूरा stimulate करना है, तो you need at least a 6-inch long needle. Needling at the scalp should be gentle because it's a very vascular area. Just remember, it's a vascular area. A strong stimulation is to be avoided. Again, cranial nerves can precipitate epilepsy. Okay. Best way to stimulate this area is using the hammer. You don't need to use a needle. You can hammer along the area. Or you can use your fingertips. Fingertips to hammer along those areas. Okay. If you have a hammer, hammering is also good. So that's all I have to say. If anybody wants to have any doubts to be cleared, please let me know. Volunteers for scalp puncture. None. नीडल नहीं करेंगे, फिंगर से टैप कराऊंगा. अब तो वॉलंटियर्स आ जाओ. आइए आइए कुर्सी लीजिए. I need one more volunteer.
One who has not volunteered. One who has, Yuri, you have volunteered. So one more volunteer who hasn't volunteered as yet. हाँ.
Mark the AP. First of all, show the AP line, show the eyebrow occipital line.
So it has to be drawn from a nasal
Run your finger along the line.
nasal
हाँ निजी हाँ आपको आँख के अंदर जा रहे हो. ये midpoint of the eyebrow.
AP line is always like.
It's in the sagittal plane. Go back. Go straight back. Midpoint of. हाँ. ये AP line. समझ में आ रही है? आप नीचे AP line. अब eyebrow occipital line होंगी.
between the eye. Intersecting the
कितने उठी चली? वो ऐसा है ना वहाँ पे really first.
अच्छा.
मैंने बोला था
आप इसका midpoint ढूंढो.
लेंस को क्या करना? नहीं, दो ऐसा नहीं.
See how
So it's over.
I find it very easy.
Reliever immediately.
Okay,
Yes.
understood? But in both sides, it should be equal. दोनों तरफ से equal होना. Or you have to have a T.
This is for the
This is the midpoint.
midpoint of
अब motor area कहाँ आ गई?
0.5
0.5 centimeters behind.
behind.
On this line, just here. This is about 0.5 centimeters. And now you have to draw a line perpendicular to this line, crossing the,
Eyebrows.
yeah, but at the hairline actually. You have to stop at the hairline. So the area is between this point and the hairline.
Either the current it will be better for the camera.
Okay. So this is the eyebrow occipital line. So here I am drawing a perpendicular.
Yeah.
So the perpendicular actually to this line would be somewhere like this. And where it is crossing the hairline, that will become the entire
Motor.
area. Divided into 5 equal parts. Lower 2/5, head and neck area, tongue, middle 2/5, upper limb, upper 1/5, lower limb. Lower limb का एक और area होता है, foot motor area, which I said is again midpoint से 1 centimeter lateral, and you draw a parallel for 3 centimeters anterior, 3 centimeters posterior. Isn't it? This becomes a foot motor area for all motor weaknesses of the foot. Remember opposite side, not the same side. Always. Now, show me the vasomotor area. This was the, I'm putting my finger here. This is the motor area. Show me the vasomotor area.
सर ने तो इतना स्ट्रेस करके लाइन बताया था कि मोटर एरिया मोटर एरिया
The usage area.
यूजेज एरिया
यहाँ दिखाओ, इधर दिखाओ. इस तरफ दिखाओ. Show me the parietal tubercle. Where is the parietal tubercle? यहाँ नहीं हो. Parietal tubercle इधर. ये parietal bone है. इनका इधर. This here is the tubercle. Parietal tubercle. Isn't it? So you will be drawing two lines like that. This becomes your usage. Okay. Now where is your auditory and speech area? Apex of the pinna. How much above? 4 centimeters to 9 है.
2.5 centimeter
Okay. वो 4 सेंटीमीटर लाइन ऐसी है और उसको आप 4 सेंटीमीटर पीछे करें. आगे के 4 सेंटीमीटर ऑडिटरी है और पीछे के 4 सेंटीमीटर पीछे. ठीक है. गैस्ट्रिक एरिया बताइए कहाँ है?
नहीं प्यूपिल का ऊपर midpoint of the eyebrows
Again, you have to
straight
look at the hairline. So his hairline is coming here. I'm just okay. आगे तो खोलो, pupil दिखनी चाहिए. Pupil नहीं दिखेगी तो कैसे बनाएंगे? अगर प्यूपिल इधर है तो अब यहाँ से आप सीधा ऊपर चले जाएंगे, ये पॉइंट है, इसके ऊपर, इसके ऊपर, ठीक है. So this becomes gastric. Now some books have also mentioned इसी लाइन को अगर आप नीचे भी एक्सटेंड कर दो तो ये लिवर एंड गॉल ब्लैडर प्रॉब्लम्स. Some books have mentioned, not all.
GB14.
ठीक है, वो एक्चुअली GB14 की तरफ जाएगी, यांग बाई की तरफ जाएगी, ये एरिया. So liver and gallbladder problems, but many books have not mentioned it. They have only mentioned gastric area. ठीक है, इसके और आगे बीच में क्या आता है, thoracic area. Lateral. Midpoint of कितना lateral जाओगे? Midpoint of between the gastric area and
Airline where it is ending.
Okay. वहाँ पे where the airline is ending, that area becomes a reproductive area. Where the airline is dipping and ending, that becomes a reproductive area. And midpoint between these two becomes a thoracic area. Okay. What it? Balance areas, visual areas, occipital tubercle. Here are the two occipital tubercles here. इनका midpoint है इधर. Okay. Where the eyebrow occipital line is going to end here. अब इसके कितना पीछे लेना है? How much away from this? How much away is the visual area? How much away is the balance area? 3.5 is the balance area and
Visual is more.
exactly. Okay, that is the visual area. Lines drawn perpendicular up.
एक सर आप शॉर्ट टर्म मेमोरी के लिए बताते थे.
तो ये इंटांग है.
नहीं स्कैल्प में भी कुछ बताते
हेल्प में ये है ना.
अच्छा ये यूजेज एरिया है.
यूजेज एरिया.
Okay, any questions?
Right. Thank you. We end the session here. Can we stop the recording?
Yes, please, your turn.
So, sir, shall we close this session?
Nikshita, can we stop the recording?
Sir,
Thank
I
you.
have stopped the recording.